You may think you're doing everything right. You're watching what you eat. You're trying to stay active. You're taking care of your blood pressure. You're getting older, but you're doing your best to stay healthy. And then something changes. Maybe your erections aren't as strong as they used to be. Maybe it takes longer to get one. Maybe you can't maintain it the way you once could. Maybe your sex drive isn't what it used to be. And instead of asking why, you tell yourself something very simple. I'm getting older. This is normal. That sentence may be one of the biggest mistakes a man over 60 can make. Not because aging doesn't affect sexual function. It does. Your body changes. Your hormones can change. Your circulation can change. Your medications can change. Your sleep can change. Your stress can change. But there's an important difference between getting older and simply accepting every change without investigating it. And that's what we're talking about today. Because the number one mistake isn't having a sexual problem after 60. The mistake is ignoring it. Welcome to the Modern Gentleman's Health, where we talk about the health, strength, confidence, and longevity that matter to men as they get older. And if you're over 60, stay with me, because by the end of this video, you'll understand 5 practical things you can do to protect your sexual health without falling for miracle pills or internet myths. Let's start with something every man should understand. Your age isn't the whole story. Imagine you wake up one morning and your car doesn't start as easily as it used to. You turn the key, the engine struggles. You try again, eventually it starts. Would you simply say, well, the car is 15 years old, that's what happens? Maybe, but you'd probably want to know what caused the change. Was the battery getting weak? Was there a fuel problem? Was something wrong with the engine? You'd investigate. Your body deserves the same attention. If something changes repeatedly, don't automatically blame your age. Ask, what changed? Because erectile difficulties can have many possible causes: blood vessel problems, diabetes, certain medications, hormonal issues, stress, anxiety, smoking, excessive alcohol, physical inactivity, poor sleep, and other health conditions. That doesn't mean every man with erectile difficulties has a serious disease. It doesn't. But it does mean that persistent changes deserve attention rather than automatic dismissal. And that's especially important as you get older, because sometimes sexual health can give you information about your overall health. Think about what an erection requires. Blood needs to flow properly. Nerves need to work properly. The brain needs to send signals. Hormones play a role. Psychological factors matter. And your overall physical health matters. It's a complicated system. So when something changes, it's worth asking why. The dangerous sentence, "It's just my age." This is where many men get stuck. You notice a change. You don't want to talk about it. You don't want to make an appointment. You don't want anyone to know. So you convince yourself it's normal. Then months pass, sometimes years, and the longer you ignore it, the more comfortable the problem becomes. Not because it improved, because you've adjusted your expectations. You stop initiating intimacy. You stop talking about sex. You stop expecting your body to respond. You begin thinking, that's just how things are now. But here's the thing. You don't have to compare yourself with the man you were at 25. That's not the goal. The goal isn't to become 25 again. The goal is to understand your body today and make the most of the health you have now. That's what modern aging should look like. Not pretending you're young. Not giving up because you're older, but understanding what's happening and making intelligent decisions. Here's why sexual health deserves attention. An erection isn't simply a sexual event. It's a physical process involving blood vessels, nerves, hormones, and psychological factors. That means changes in erectile function can sometimes occur alongside changes in cardiovascular health or metabolic health. For example, conditions that affect blood vessels can also affect erectile function. Diabetes can damage blood vessels and nerves. High blood pressure can affect vascular health. Smoking can damage blood vessels. Some medications can contribute to erectile difficulties, and psychological stress can make things worse. So if something has changed, don't immediately assume the worst, but don't automatically assume the best either. Instead, investigate. That's the mature response. That's what a modern gentleman does. He pays attention to his body. He doesn't panic. He doesn't ignore warning signs. He gets informed. And when necessary, he talks to a professional. But there's another problem: embarrassment. Let's be honest, men can talk about almost anything: back pain, knee pain, high cholesterol, blood pressure, work, money, politics, sports. But mention erectile problems? Suddenly, the conversation becomes uncomfortable. A man might think, I don't want to talk about that. What will my doctor think? It's embarrassing. Maybe it'll go away. I'll just find something online. And that's where things can get dangerous, because the internet is full of promises. One pill, one vitamin, one powder, one drink, one secret ingredient, instant results, works at any age, guaranteed. Be careful. Your sexual health is too important to hand over to a random advertisement. If something has changed, find out what may be causing it. Don't just cover the symptom without understanding the bigger picture. So what can you actually do? Let's go through 5 things, and number 1 is the most important. Number 1, stop ignoring persistent changes. If something happens once, don't immediately assume there's a serious problem. You can have an off day. You can be exhausted. You can be stressed. You can sleep badly. You can drink more alcohol than usual. Your body doesn't perform exactly the same way every single day. That's normal. But if the problem keeps happening, pay attention. If you're repeatedly having difficulty getting or maintaining an erection, talk to your healthcare professional. Don't diagnose yourself. Don't panic. And don't simply say, I'm over 60, so there's nothing I can do. There may be several possible explanations, and many causes of erectile difficulties can be addressed. The first step is finding out what's actually happening. Number 2, take your heart health seriously. This may surprise some men, but your sexual health and cardiovascular health are not completely separate. Your blood vessels are involved in both. That's why the boring health numbers matter: blood pressure, blood sugar, cholesterol, body weight, physical activity, smoking. These aren't just numbers your doctor reads once a year. They're clues about how your body is functioning. If you haven't checked your blood pressure recently, check it. If you're due for blood work, don't keep postponing it. If you have diabetes or high blood pressure, take your treatment seriously. And if you smoke, getting help to quit can benefit your overall health in many ways. You don't need to become obsessed with your health. You just need to stop ignoring it. Number 3, move your body. You don't need to become a professional athlete. You don't need to spend 2 hours in a gym. You don't even need expensive equipment. Start walking. If you're able to walk safely, make it part of your day. Walk around your neighborhood. Walk after a meal. Take the stairs when appropriate. Work in the garden. Do household tasks. Add strength training if it's appropriate for your health and fitness level. The point is simple. Your body needs movement, and physical activity supports cardiovascular health, physical function, and overall well-being. Don't think, I need the perfect workout. Think, how can I move more consistently? That's a much better question, because a perfect workout you do once isn't nearly as useful as a simple routine you actually maintain. Number 4, review your medications. This one many men overlook. Some medications can contribute to sexual difficulties. That doesn't mean your medication is bad, and it definitely doesn't mean you should stop taking it. Never stop a prescribed medication on your own because you think it might be affecting your sexual health. Instead, talk to your doctor. Tell them what's happening. They may determine that your medication isn't the cause, or they may find that another option is appropriate. The important thing is communication. Your doctor can't help with a problem they don't know about, and you shouldn't feel embarrassed about bringing it up. These conversations are part of healthcare. Number 5, protect your confidence. This one is different, because sometimes the physical problem isn't the only problem. Imagine you have one difficult experience. You're intimate with your partner, and your body doesn't respond the way you expected. You feel embarrassed. You start worrying about it. Then, the next time you're intimate, you're thinking, what if it happens again? Now you're not focused on your partner. You're focused on your performance. That pressure can make intimacy even more difficult. And suddenly, one bad experience becomes a cycle. You worry, you avoid intimacy, you become less confident, you worry even more. So don't turn sex into a test. You're not taking an exam. You're sharing an experience with another person. Communication matters. Affection matters. Touch matters. Closeness matters. And intimacy is much bigger than one physical response. If you're in a relationship, talk honestly with your partner. You don't have to explain everything perfectly. You can simply say, "I've noticed some changes, and I think we should talk about them." That conversation may remove more pressure than you realize. And there's one more thing men need to hear. Don't compare yourself with the man you were decades ago. Your body isn't supposed to be identical at 65 to what it was at 25. That's not failure, that's aging. But aging doesn't mean giving up. It means adapting. Maybe you need more time. Maybe you need better sleep. Maybe you need to exercise more consistently. Maybe you need to address a health condition. Maybe a medication needs to be reviewed. Maybe stress is affecting you. Maybe you need medical treatment. Maybe you simply need to communicate better with your partner. There isn't one answer for every man. And that's exactly why the one magic pill mentality is so dangerous. Your body isn't a machine with one broken part. It's a system. You have to look at the whole picture. Don't fall for the miracle